What are the treatments for depression other than drugs? Traditionally, medications, antidepressants, and psychotherapy have been used in the treatment of depression, but there are some new treatments, relatively new, past 10 years. What are they? The first would be transcranial magnetic stimulation. What is that? Transcranial magnetic stimulation, otherwise known as TMS, is a procedure where a magnet is put on the dorsolateral prefrontal cortex. And that is the area of the brain that's considered to be working poorly, working slowly, hypoactive electrical areas of the brain. And it's usually on the left side. So we're looking at the camera, so it would be right here, basically, this area of my brain. And they locate that area of the brain when you're getting TMS. And basically you sit in like a dental chair, what looks like a dental chair, and they put this magnet next to your brain, and it clicks for about 4 seconds, rests for 27 seconds, and it continues on that cycle for about 37 minutes. So it takes about an hour to do each treatment. The magnetic pulses induce electrical activity in the brain, and that area of the brain is stimulated, increasing your ability or increasing that portion of the brain to work better. So in an area of the brain that works slowly, we're speeding it up. We're sending a magnetic wave into the brain that changes electrical activity by inducing electrical activity in the dorsolateral prefrontal cortex. Now, how many of these procedures do you need? It takes about 6 weeks every day, so about 30 treatments. It kicks in about 2 weeks. You really get a little bit of a response, and then at about 6 weeks, you have the full response. Some people may require maintenance treatments every month after that, indefinitely. The cycle of treatment usually lasts 6 months to 2 years. It's very effective. The candidates for it are people who usually have been tried on 2, 3, 4 antidepressants and psychotherapy, and nothing's working. It's usually people who are not on benzodiazepines, because people who are on one or more, the equivalent of 1 or more milligrams of Klonopin, Ativan, or Xanax a day, that slows brain activity and prevents really this procedure from working. And people who are suffering from a death, a trauma, it doesn't work that well. But people who just develop depression, it works well. If your son was just put in jail, if your wife died, or you lost a child, it doesn't work well. But if someone is just going through life and says, I'm so depressed and I can't shake it, my mother was depressed, they are very good candidates. Side effects, it could be a little irritating. It's noisy when you get the procedure. It has a clicking noise, on this part of your head, click, 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 and kind of taps your head. You could have jerky muscle movements. Otherwise, the procedure is tolerated very well. I think it's very effective, and it's a great option for people who failed on medications. There's another treatment. There's transcranial magnetic stimulation. Then there's transcranial electrical stimulation called TES. TES is a little different. I would say much more research has been done on transcranial magnetic stimulation. It's indicated for depression. It also may help for anxiety and pain control. Transcranial electrical stimulation TES is different. It is indicated for depression, anxiety, and insomnia. It's basically putting an electrode here and behind each ear. You sit for 40 minutes on the machine. It's a frequency generator, and this changes or reboots the frequency, the electrical signals in your brain to conform to the electrical signals of the machine, thus bringing around changes. It raises levels of dopamine and serotonin in the cerebral spinal fluid. I found it in my office to possibly be as effective as medication. Granted, this has not been studied as much. It was originally used in Russia. It's old technology. It was studied at the Pavlov Institute in St. Petersburg, Russia. The final treatment is ECT, electroconvulsive therapy. This came out in the late 40s. This procedure involves putting electrodes on one side of the brain, usually, but it can be both, stimulating a seizure. And usually it's a course of 6 treatments every other day for 2 weeks. And I would say it's dramatically effective. It requires being in a hospital. It requires anesthesia. The problem with this procedure, TMS, transcranial magnetic stimulation, and TES, transcranial electrical stimulation, minimal side effects. Really, almost side effect free. You can never say that, but they're dramatic. It's pretty dramatic how little they are. But ECT, the problem is, ECT may cause permanent memory problems. So it's only used, I would say, if someone is overtly suicidal and nothing is else working. But it's dramatic in its effect, and it works very well. It's still used, although it sounds barbaric and primitive and people look at it as some horrible treatment. When it comes down to it, I use it once or twice a year in my office when someone is actively suicidal, and I've literally tried everything. I've tried TES, I've tried TMS, I've tried all the medicines I could think of. Just remember, there are some downsides to TMS. It's costly. It can cost $10,000 to $20,000 for a course of treatment. TES costs between $2,000 and $3,000 for a course of treatment. And ECT is usually covered by insurance. The other two usually are not, but can be. The ECT, I'm not sure what that costs because it's usually in the hospital. Insurance covers it. So these are the 3 alternatives to medications and psychotherapy that are out there. You can find more about this on my book, Tales from the Couch, on Amazon.com. Thank you.